अस्सलाम वालेकुम नाजरीन, आप देख रहे हैं आज एक खुसूसी नशिस्त जिसका हमने एहतमाम किया है कुछ बहुत ही अहम इशूज़ पर बात करने के लिए। जब हम बात करते हैं पाकिस्तान के अंदर सोशल अपलिफ्ट की या सोशल अपलिफ्ट से जुड़े मामलात की या मसाइल की, तो बहुत सारे एरियाज़ ऐसे हैं जिन पर हम समझते हैं कि बहुत सारा काम करने की भी ज़रूरत है, बहुत ज़्यादा फोकस करने की भी ज़रूरत है। जिसके अंदर हम बात करें तालीम की, सेहत की, ये वो एरियाज़ हैं जिनके बारे में हम बात कहीं ना कहीं ज़रूर सुनते हैं कि हो रही है, लेकिन अगर हम ग्राउंड पर जाकर देखें तो काम शायद बहुत कम होता है। अगर हम बात करें रिसोर्स एलोकेशन की, तो वो भी हमें बताया तो जाता है कि की जाती है इन सेक्टर्स के अंदर, लेकिन अगेन जब हम ग्राउंड पर जाके देखते हैं तो कितना वो रिसोर्स जो है वो ट्रांसलेट होता है इनटू रियल वर्क, मेरा ख्याल है कि वो ग्राउंड पर जाके देखें तभी पता चलता है। तो कुछ आज की इस नशिस्त में इसी तरह से इसी से जुड़े कुछ मामलात हैं जिन पर बात करेंगे, क्योंकि पाकिस्तान के अंदर बहुत से ऐसे दोस्त ममालिक हैं जो कि इन एरियाज़ के ऊपर बहुत ज़्यादा कॉन्ट्रीब्यूट भी कर रहे हैं, काम भी कर रहे हैं, हमें सपोर्ट भी कर रहे हैं। और उनमें अगर उन ममालिक की फहरिस्त में अगर मैं बात करूँ तो जर्मनी जो है वो सरे फहरिस्त है। यहाँ पर उनके बहुत ही इंटरेस्टिंग, बड़े इंपॉर्टेंट, बड़े सिग्निफिकेंट ऑपरेशंस हैं, खासतौर पे जब हम हेल्थ सेक्टर की बात करते हैं। और अभी जिस प्रोग्राम के बारे में मैं स्पेसिफिकली आज की इस नशिस्त में बात करूंगी, उसकी जो एक और हाईलाइट है वो ये है कि वो ना सिर्फ बात करता है या फोकस करता है हेल्थ सेक्टर या हेल्थ सेक्टर की अपलिफ्ट पर, बल्कि साथ ही साथ विमेन एम्पावरमेंट की भी बात करता है। ये कुछ सेल्फ जो है वो एम्प्लॉयमेंट क्लिनिक्स हैं खवातीन के हेल्थ सेक्टर के अंदर। इस प्रोजेक्ट को सेल्फ एम्प्लॉयमेंट फॉर विमेन इन द हेल्थ सेक्टर कहा जाता है। पाकिस्तान के मुख्तलिफ इलाकों में KPK और पंजाब में ये जो है ऑपरेट कर रहे हैं ऑलरेडी। वहीं लोकल कम्युनिटी से ताल्लुक रखने वाली खवातीन जिनको प्रॉपरली पहले इन एरियाज में ट्रेन किया जाता है मेडिकल केयर के लिए भी और एंटरप्रेन्योरशिप के लिए भी, और उसके बाद ये क्लिनिक्स उनको सेटअप करके दिए जाते हैं ताकि रिमोटेस्ट एरियाज जो हैं इन इलाकों के, वहाँ पर जो खवातीन जिनको एक्सेस नहीं है, खासतौर पर मदर चाइल्ड केयर के हवाले से, मैटरनिटी वाला जो एलिमेंट है उसके हवाले से, तो वो आकर जो है यहाँ पर उनको रसाई भी हो सकती है अच्छी मेडिकल केयर तक। और फिर ऑफकोर्स जब हम बात करते हैं बहुत सारी इकोनॉमिक एक्टिविटी भी इसके साथ जुड़ी है, वो क्या है उस पर भी बात करेंगे, मैं बात करूंगी ड्यूरिंग द कोर्स ऑफ द डिस्कशन। और इस बहुत ही इंपॉर्टेंट इशू पे बात करने के लिए मेरे पास एक बहुत ही ऑगस्ट पैनल है आज। आई एम जॉइंड बाय द एम्बेसडर टू जर्मनी एंड पाकिस्तान हरसेल्फ, एक्सीलेंसी मिस ईना लेपिल इज विद मी। थैंक यू सो मच मैडम फॉर योर टाइम।
It's an absolute pleasure. It's a great pleasure.
No, it's an absolute pleasure not just to have you here but to talk about such an important initiative, especially which where the women of this country are the center or the focus of the entire thing. So I'm going to include you in the discussion. Before that, if you allow me, I'll introduce
Absolutely.
the rest of the guests that I have here with me. Sitting right next to Excellency, I am joined by Director KFW. थोड़ा सा KFW के बारे में बता दूं, जो इस्लामाबाद के उनके ऑफिस के डायरेक्टर हैं, वो यहाँ पर उनका तारुफ भी मैं करवाऊंगी। इट्स अ जर्मन बैंक, बहुत पुराना हमारा इनके साथ रिश्ता है जब हम पाकिस्तान के हवाले से बात करते हैं। और जब हम बात करते हैं सोशल सेक्टर के अंदर, तो मैं तो बहुत अमेज हुई हूँ देख के कि बहुत कंट्रीब्यूशन है। वो क्या है उस पर मैं उनसे उन्हीं की ज़बानी पूछूंगी। आई एम जॉइंड बाय मिस्टर सेबास्टियन याकूबी। थैंक यू सो मच सर फॉर योर टाइम ऑल्सो। और उनके साथ जो है वो तशरीफ रखे हुए हैं CEO हैं ग्रीन स्टार सोशल मार्केटिंग के। ग्रीन स्टार सोशल मार्केटिंग अगेन इस प्रोग्राम की भी अगर हम स्पेसिफिकली बात करें तो ग्राउंड के ऊपर जो एग्जीक्यूशन है वो सारे मामला को ग्रीन स्टार मार्केटिंग जो है वो देख रही है, कैसे एग्जीक्यूट कर रही है, जो पार्टनरशिप है इन लोगों के साथ वो कैसी है, उसकी क्या खदोखाल है, थोड़ा सा उस पर भी बात करेंगे। मेरे साथ यहाँ पर मौजूद है डॉक्टर सैयद अजीजुर रब साहब। बहुत शुक्रिया सर,
थैंक यू वेरी मच,
आपने प्रोग्राम में वक्त दिया। इट्स एन एब्सोल्यूट प्लेजर टू हैव ऑल थ्री ऑफ यू हियर। मैडम, if I could just start with you. When we talk about Germany and Pakistan, I think Germany has been one of the most consistent development partners that we've had here in this country. If I start the discussion by asking you that what are the key priorities of the German government when it comes to the development sector here in Pakistan, what would they be?
Well, let me first of all say that yes, indeed, our cooperation goes back more than 60 years.
Yeah.
And one basis is also shared values like sustainable development, human dignity, resilience. So proceeding from that, we have three main areas of cooperation. One is the climate and energy partnership that we share. One is social protection and health. And one is sustainable development. And practically that means strengthening vocational and technical training and strengthening the private sector in general.
Right. So when we talk about climate resilience, I think Pakistan is again one of the most affected countries in the world, when it the top 10 affected countries in the world with climate change. But since we're talking about the health sector here today, about this program specifically, and how do you look at incorporating women empowerment in the health sector and trying to reach out to women in the remotest areas of Pakistan? How do you look at this program specifically?
Well, I think women are such an important part of the society. I mean, 50% just numerically, but also as mothers, as the first educators. So this is too important to neglect, and also women want to contribute and want to be a part of it. So I think this project that will be presented in more detail later really bridges an important gap. There are unemployed women who have the skills to actually improve the health of their communities. And by the project, they are enabled to start small clinics where they can treat especially women and children and do all this child and maternal health programs that cannot be brought to every remote village by the system as it is. So they deliver this important service, and at the same time they can also earn an income with which they can also better support their own family.
Right. So we will definitely go into the specifics of the program, but before I move forward, a little of your take on how do you look at the cooperation between our two countries vis-a-vis sustainable economic growth?
Well, we work together very well on that.
Yeah.
Sustainable development also means inclusive development, making sure that nobody is left behind. So we work with some innovative approaches, including insurance also. So we have some programs where people receive health insurance, especially the very poorest segment of the society, for whom this kind of issue, if they get sick, if they need expensive treatment, can throw the whole family into debt and poverty. But if they have insurance, then they still have to cope with the illness, but they are safe from the financial consequences.
Right.
So I think this is something really important to promote the health sector and to create a more sustainable economy.
Right. So taking the discussion a little forward, I'd like to include Mr. Yaqubi. Thank you so much, sir. You are the director of the KFW office here in Islamabad. KFW and we go back a long way, I believe. True. So if I could ask you to please, if we can start with how do you define your journey? The KFW journey here in Pakistan. If I could ask you to share some of your flagship programs, maybe in the details, what exactly are we doing here in Pakistan when it comes to KFW?
Yeah, thank you. Happy to talk a little bit about KFW.
Yeah,
and in fact, our cooperation goes back also more than 60 years. And I think since then we have achieved together a lot. We work in the areas that Ambassador has mentioned, energy, climate. We've worked a lot on hydropower projects, energy efficiency projects, solar. Currently we work on startup projects, microfinance projects, and in the field of nutrition, health, and social protection. I would even say for decades, we've been working in the field of reproductive health services.
Right.
And here we can say more than 1.5 million mothers and children have benefited from these projects, which is a lot.
Yeah.
Right. Also, when we look at safe blood centers, so if you go out and see a blood center in Pakistan, chances are that it's financed by KFW, because we financed on behalf of the German government 40% of all blood centers here in Pakistan. Right now we work with the Benazir Income Support Program on the National Numa program, providing nutrition services to mothers and children. So actually we do a lot. It's a broad scope. We are happy to support Pakistan in its development, in its growth. And so yeah, that's the mandate, right? We finance development and hopefully improve life and livelihoods here in Pakistan.
Trust me, the Pakistani people are grateful for that also. And I think, if I'm not wrong, KFW steps up and is out there when Pakistan is hit by a natural calamity like floods, earthquakes and all that?
Yes. Yes, especially when we look at the floods in 2022, which were really devastating.
I think it was quite a massive contribution from KFW.
Yes, quite a lot. We work together with UNDP here, providing reconstruction services in Balochistan, because as you know, Balochistan was heavily affected. Also in KP, in Khyber Pakhtunkhwa, we provide financing for reconstruction of infrastructure. So we try to do our share to help Pakistan cope with these devastating effects of the floods.
बिल्कुल सही है. Thank you so much. डॉक्टर साहब, थोड़ा सा आप जो है वो इसको मजीद एलैबोरेट करें कि जब हम ये बात करते हैं, खासतौर पे क्योंकि आप जो है वो ग्रीन स्टार को रिप्रेजेंट कर रहे हैं, और जो मैं समझी हूँ इस सारे प्रोग्राम के बारे में, इसके स्पेसिफिक्स में थोड़ा सा जाना शुरू करते हैं कि आप लोग जो एग्जीक्यूशन है, जब हम बात करते हैं जो सेल्फ एम्प्लॉयमेंट जो क्लिनिक्स हैं या हेल्थ सेक्टर के अंदर जो खवातीन का रोल है, उसके बारे में तो ग्राउंड पे एग्जीक्यूशन आप देख रहे हैं, ऐसा ही है सर? तो थोड़ा सा सर उसकी क्या डायनामिक्स हैं, इनके साथ काम करना, फंडिंग को किस तरीके से हैंडल करते हैं, उसकी एग्जीक्यूशन का प्रोसेस क्या है, थोड़ा सा अगर वो बताएं.
First of all, Yasmin, I'm really grateful to you और न्यू टेलीविज़न को मुबारक हो, क्योंकि इस वक्त मुल्क के अंदर शायद कोई इन चीज़ों के ऊपर ज़्यादा जोर नहीं दे रहा है. अब लोगों का क्या बन रहा है, right? So this program is about the women and children of Pakistan, so 10 out of 10 to you. So thank you very much for giving us this opportunity.
Thank you.
Now let me just give you the background, okay, what we are actually trying to do. In Pakistan every year 13 million pregnancies takes place. Out of these 6 million are unwanted. And whenever there is unwanted pregnancy, there are complications. And 3.8 million abortions takes place every year. And when 3.8 million abortions take place, that means 1,000 women die every month due to complications of pregnancy. And there is no headline.
बहुत बड़ा number.
4.5 A320 Airbuses crash every month as 1,000 women across Pakistan died because they should not have become pregnant. So it looks at statistics, very scary, but we don't see headline. These are not children of lesser God. These should not. What has actually happened here? We are now almost 255 million. All this contribution that we are talking about and the areas that we need, it has to be seen in the perspective. 255 million की आबादी हो गई अब, and the way at the rate at which we are ground. Why are these women dying? They did not have the choice to choose the timing of the pregnancies, number of times they should become pregnancy, and the spacing become pregnancies. 60% of them are anemic. Almost 80% have vitamin D deficiencies. 25% of them calcium deficient. So all these deficiencies lead to death and the intrauterine growth retardation of children.
Yeah.
If this child is born, chances are that it is not going to attain the age of 5. It's going to die because of diarrhea and pneumonia. And if they survive beyond that time, 40% is going to become stunted. Now, this is the sad part of story, right? The statistics are scary. What are we doing about it? And what is Pakistan and German government are up to? So they envisaged this whole idea and they came up with the plan that maternal and child health, maternal and child mortality and morbidity, माँ और बच्चों की शरह अमवात को कम करना है.
कम करना.
तो 30% आबादी जो है, अब फैक्ट क्या है पाकिस्तान में कि 50% are women, right? And 64% are youth. And as a result of which 70% of the people from out-of-pocket expenses go to the private sector. 50% आबादी ख़वातीन पे मुश्तमिल है, 64% नौजवान है और 70% प्राइवेट सेक्टर में जाती है. अगर इलाज मालजे की सहूलियात नहीं होगी, अगर इन माओं को मरने से बचाना है तो 1000 days stay, the day he conceives and the 1000 day, who's going to take care of so the mother doesn't suffer from intrauterine growth retardation and child doesn't die. It's not about तादाद. गली मोहल्लों में यशवीन आप बहुत अच्छी तरह जा रही, कोई गाय भैंस मर जाए ना तो कोहराम मच जाता है कि दूध देती है.
बिल्कुल.
5वीं प्रेगनेंसी में औरत फड़क जाए तो कोई फर्क नहीं पड़ता, औरतें तो मरती रहती है. So it's not about
unfortunate बच्चों.
It's not about numbers. It's about तादाद and इस्तेदाद की बात है यहाँ पे. Now the second part of it, what is SEW project is doing? 50% of the women are women and only 22% are in the workforce. So you're fighting like a one-arm boxer if these women are at home producing children or dying or
You're not even using your one arm fully. Unfortunately.
Absolutely.
वो भी हम पूरा इस्तेमाल नहीं कर रहे.
So this German development supported program, KFW and the Green Star executed it, and the idea was to create an ecosystem.
Right.
And one of the principles is that usually when programs are there, vertical programs and the impact is gone. So the term coined by the German government and KFW was that it has to be sustainable and scalable.
Yeah.
Because programs end, it should not go. So this beautiful idea came up that, look, let's go to those areas where government is not present, number one. In 2 to 5 kilometers, there is no health facility. There is a service provider and she is willing to put something on her table. जबरदस्त बात ये हुई कि उसके घर वालों को कन्विंस किया गया कि अपने अब्बा से या शौहर से कहो जमीन तुम्हारे नाम मुंतकिल करे. अब उसके पास एक प्लॉट है. उस प्लॉट पे जर्मन गवर्नमेंट के पैसे से क्लिनिक बनाई गई. उस जैसा क्लिनिक वहां उसको फुल इक्विप किया गया. इसको ट्रेनिंग दी गई और जैसे कि आपने अपने इंट्रो में ही बता दिया था कि उसको सोशल एंटरप्रेन्योरशिप की ट्रेनिंग दी गई. If you allow me,
इकोनॉमिक एक्टिविटी भी है.
जी, अब you can see that these are the clinics, 200 of them, 130 in Punjab and 70 in KP. This is a great competition, and coming from these areas to the city areas to deliver babies is almost an impossibility.
Yeah.
You will deliver on the way.
On the way.
So these are the only hope of this areas where these clinics are constructed. And this is the service provider who has got a service delivery room, birthing a station, and she's taking care of 1,000-day journey of the women who become pregnant, then taking care of their nutritional need, safe delivery, and after delivery, asking them adopt one method of family planning so that we need to keep these moms alive. Yeah. Because every time a child dies, there is a pressure on the mother to give birth to another one.
So she's not just a trained healthcare worker, but a community awareness worker also at the same time.
यशविन एक और चीज जबरदस्त हुई इनके पास हमने सितारा बाजी is the community mobilizer जो goes door to door visits and counsels the people and women and girls and brings them to there. And as Your Excellency you were mentioning, are we talking about diseases that are transferred because of the inter-family marriages? Yes, this Sitara Baji goes door to door, visits, neighborhood meetings, and talks about premarital family planning and reproductive health counseling.
Right.
Right, so that cousin marriages which are on the rise, they should be avoided. And then as a result of which, what we have done is that we have given a basket of box to Sitara Bajis, who does not only creates awareness, he also earns some money by selling certain products related to maternal and child mortality and morbidity.
And what a wonderful name to call these workers, Sitara Baji. I really have to appreciate whoever thought of this. I have to take a very quick break here. So after the break, we're going to continue with our discussion. Music break का वक्त हो रहा है, हमारे साथ रहिएगा. जी वेलकम बैक नाज़रीन. जैसा कि आप जानते हैं कि आज की इस नशिस्त में हम बात करें बहुत ही इंपॉर्टेंट इश्यूज़ के ऊपर. मेरे साथ बहुत ही एक बड़ा और इम्पॉर्टेंट पैनल मौजूद है. जर्मनी की सफ़ीर पाकिस्तान में, वो इस वक्त यहाँ पर तशरीफ़ फरमाए. उनके साथ जब हम बात करते हैं इनिशिएटिव्स को एग्जीक्यूट करने के लिए और फंड करने के लिए KFW के रिप्रेजेंटेटिव हैं, ग्रीन स्टार सोशल मार्केटिंग पाकिस्तान के रिप्रेजेंटेटिव हैं, और हम बात कर रहे हैं ये जो कुछ सेल्फ सफिशेंट ख़वातीन के क्लिनिक्स हैं उनके हवाले से भी, और फर्दर जो जर्मनी की हुकूमत की पाकिस्तान के साथ ताउन है मुख्तलिफ एरियाज़ के अंदर, उसके हवाले से भी. सो I'd like to include Her Excellency again on a very important issue. When we talk about Germany's cooperation with Pakistan, Germany has also been supporting Pakistan in the SDG attainment program, also the Sustainable Development Goals. When we talk about it, how do you look at it? What is Germany's contribution, and how is Germany working with us regarding the SDGs?
Well, we fully support Pakistan's efforts in achieving this Sustainable Development Goals, because this is something that has been agreed by the United Nations, and it's a very good set of targets that are well worth pursuing, also in an integrated and holistic manner.
Yeah.
So this should, of course, particularly happen in remote areas. It's relatively easy to do in cities because everybody is there and people can get together easily. But the huge land masses where remote villages are there, it's important to be there as well, and to start early at the maternal and child health level.
Yeah. Because
as was pointed out by colleagues here, if we start with a sickly child, that is already a very unfortunate burden, not just on the child and the family, but basically on the nation's health system and education system, which is already struggling. So I think focusing on child and maternal health and also nutrition, these are very important fields, and they create multiplier effects which can help the whole society to advance and be more healthy and be more ready for learning and for contributing to society.
Right, and the real challenge also lies in reaching out to the people in the remotest areas or the rural areas. How do you see public-private partnership emerging in the bigger picture, or playing a role in all of this?
Beautiful.
Private-public partnerships are key in this, because there is only so much budget that the government has. But with the private sector coming in and following its own logic, we can really build a stronger cooperation. And with partners like Green Stars, I think we are presenting a good example of how this can be working,
yeah,
and how we can achieve very good results together.
Yeah, I mean, they're definitely doing some wonderful work. I really have to give it to you. But Mr. Yaqubi, if I ask you, since you've been associated with this sector for so long and you're working and you're so active, what do you think are Pakistan's biggest challenges when it comes to our social uplift, especially the healthcare sector?
Yeah, well, I think there are many challenges, and I mean, you can see it objectively when you look at the healthcare indicators,
yeah,
that the sector is in a bad shape. If we look at malnutrition, stunting, mortality of women, So these are indicators where you find the same level in sub-Saharan Africa. So that should not be for a country like Pakistan. Right? So what are the reasons? I think the reasons are manifold. I would just like to concentrate on one, which is funding. Again, if we look at the figures, so the funding from the government that goes into healthcare is less than 1% of the budget, or less than 1% of the GDP, the gross domestic product. You compare that to countries like in the neighborhood, Bangladesh. They spend twice as much to health. Germany, instead of 1%, spends 12%. Wow. So of course, I mean, this has implication. A lack of funding has implication when it comes to qualification of doctors, infrastructure, etc. So I think that is one of the central reasons for the state of the healthcare infrastructure and healthcare system here in Pakistan.
Right. So which part of the health delivery system, the entire chain, do you think needs the most improvement or needs the more focus?
Well, of course, I think all parts need improvement, but primary healthcare is, I think, essential. And what we can see here, and it's no secret, here in Islamabad, for example, when I need a doctor, I can pretty much find a good doctor in a good hospital. But look at the rural side, the countryside, things are very much different there. So there's a big inequality between urban side and rural side. So I think Pakistan needs much more healthcare infrastructure in the rural areas of the country. Basic healthcare services, this is really crucial. Yeah,
you do find a good doctor in Islamabad, but it's very expensive also. So that comes with a very huge price also, which of course most people cannot afford, unfortunately, in this country. Doctor Saab, koi success story? जब हम कहते हैं ना, आप क्योंकि एग्जीक्यूट कर रहे हैं और ये जो क्लिनिक्स आपने अभी मुझे दिखाए, मेरा ख्याल है तो वैसे इन इटसेल्फ ही सक्सेस स्टोरी है, स्ट्रक्चर भी बहुत बड़ी सक्सेस स्टोरी है, लेकिन फिर भी कोई इस तरह के क्लिनिक्स जो आपको लगता है कि कोई इस तरह के इलाकों में थे जहां पे कोई कॉन्सेप्ट ही नहीं था खवातीन की हेल्थ केयर का, बट नाउ आपको लगता है कि आप लोगों ने कर लिया है मोबिलाइज उस कम्युनिटी को?
आई थिंक यशवीन देयर आर मेनी फोल्ड्स ऑफ फर्स्ट ऑफ ऑल द डायरेक्ट बेनिफिशियरी जो इससे पिछले 6 महीनों में इन क्लिनिक्स में जो पेशेंट्स आए, तो तकरीबन 2 लाख से ज्यादा खवातीन माँ और बच्चों के लिए रजिस्टर हो गई हैं यहाँ पे, जिनको एंटीनेटल केयर फॉर 1000-day जर्नी के लिए बुक कर लिया गया. दैट मीन्स दे विल बी ट्राइंग टू कीप दीज मदर्स अलाइव बाय प्रिवेंटिंग ऑल दिस न्यूट्रिशनल डेफिशिएंसी. सो दिस इज द डायरेक्ट एनरोलमेंट. सेकेंडली, we know for sure that nothing is sustainable or scalable unless the government owns it. पंजाब गवर्नमेंट के और केपीके गवर्नमेंट के जो डेटाबेस में इलेक्ट्रॉनिक मैनेजमेंट रिकॉर्ड मैनेजमेंट सिस्टम में these service providers have been given tablets. This family planning and child mortality, morbidity and disease area is now being fed into the federal Punjab and KPK databases, DHS2. So they get the figures. जब तक किसी भी प्राइवेट सेक्टर की इंटरवेंशन का डायरेक्ट बेनिफिशियरी गवर्नमेंट नहीं होगी, व्हाई शुड दे ओन इट? So alhamdulillah, I'm very happy to report one of the great contributions is that the KFW has enabled this program, this network to get connected to the provincial. Third thing is e-health is now transforming. The tablets are being used by Green Star's group of doctors. They are helping these remote service providers to see wider. For example, gyno-dermatology. Skin की जो बीमारियां वहां हो रही हैं, वो देखने के लिए ना तो वो उसके पास सलाहियत है, ना उसको इजाजत है. She is not trained. The dermatologist in a remote area is helping her. Difficult cases of delivery, there are people sitting at the back end in the Pucho helpline, which is also.
ये मैं पूछना चाह रही थी वैसे आपसे कि how do you handle emergencies or complicated situations?
Right. So emergency obstetrics management के लिए there is a helpline, hotline being established with the fund, and as a result of which these clinics, service providers have access. For example, low-lying placenta, difficult to deliver baby. What is she going to do in this remote area? She can't present the mother. She doesn't have a consultant to go in. So online, she's getting how to plan her delivery.
Right.
And most
ये functional है ये helpline?
Absolutely, madam. 24/7 0800-11171 is a helpline. It is in Pashto, in Sindhi, and also in Punjabi and Urdu, of course. So and we are looking for people. FCDO started it, but KFW sustained it, and now we have fused this. So this program is now growing, and so that we have that ecosystem of healthcare, which is now self-sprouting. Most important thing, the floods that we have been. I'm very sorry to report that I was in Bonaire, and thank you KFW for allowing us to mobilize funds during this floods that we had recently in Bonaire. One of our clinics was in the way when the water came down, it is completely destroyed.
Right.
Luckily, the service provider was in Peshawar and her children were at school, so they survived. But now we are trying to rebuild the whole thing. You see, the ecosystem and the capacity private sector में जो create हो गई है, सैलाब आए, तूफान आए, ये दोबारा खड़े. तो पहला तो ये कहने कि climate के लिए now we have got our service providers trained with the help of Aga Khan University, who have trained our service provider about climate resilience and how these clinics can play a role in by engaging women of the community. They've got solar panels for drainage control, waste management, and infection control. So now we are including the climate aspects in these communities. So climate change, we are preparing an ecosystem of service providers. Digitalization, we are connecting with the government. E-health is increasing their ability to diagnose and treat a larger number of women. And finally, we are in October. And Green Stars, all these clinics, madam, I'm very happy to report, are conducting meetings for teaching young girls how to palpate breast for lumps to detect early for early referrals. Breast cancer, every 1 in 9 women, as you are aware. And yeah. So all
we're celebrating breast cancer awareness also. So I think it's very important.
Absolutely. So another area, and finally, we have been also being contacted by the HPV vaccine. That look, people are resisting. These clinics are deeply entrenched. They are local people. Can you help us?
That would be lovely.
Punjab government has already trained some of the people in the immunization, and I think 200 of our clinics already have the immunization practices. And finally, BIS program that we heard about, we have taken the Sitara Bajis or community mobilizers when the program ends are jobless. So what to do with them? So we have started recruiting the Sitara Baji and the people from the who are best
for the immunization programs.
No, for making them community mobilizers,
right? And
also giving them selling skills so that they can earn a living. So I think this program is also helping people pull. Poverty.
I'm so happy to hear about it, to know about it, and to know that something is being actually done on ground to cater to such issues. So now I have to wind up the discussion. Also, I'd request Madam Ambassador for your perspective or your take, or how do you view this program, especially because Germany and Pakistan, there is a lot of cooperation when we talk about these areas, as we spoke earlier also, when it comes to women empowerment and everything. So how do you look at this specific program?
Well, I think it serves so many purposes, not just for the individual women, but also for their whole community, and with their model effect also for the whole country. The women get good training and some start-off support by the program, so they can start a clinic. Normally that would be a dream for just a young woman with no resources. But with this support, they can actually start something and really make a living for themselves, plus gaining respect as a woman in their families, in their local communities. And at the same time, they can really deliver an important service for the local community. And I think better health and better child health, plus better nutrition, is an excellent basis for a strong new generation and for a strong, resilient society that can cope much better with all the challenges life is throwing at them.
Yeah, so we would agree that this is a great initiative when it comes to inclusive development in Pakistan also.
Absolutely.
Yeah, so yes. It's a great initiative like that. So a little more about how do you think that such initiatives are going to shape the future of women participation, especially in economic activity, and of course when we talk about women empowerment in general?
Yeah, no, I think this program makes a big contribution to this cause. So I mean, as we have heard, women that are formerly unemployed get employment, the household income increases, maybe even the woman makes more money than the man.
Yeah.
You know, this maybe changes also the dynamics.
The economic dynamics.
Exactly,
yeah,
and it empowers women, it gives them more confidence, and I think that's an important part of the program. So I'm happy to have this program that serves two purposes. So it's women employment, women empowerment on the one hand, but also, of course, improving the health infrastructure and health services in the rural areas of Pakistan. So I'm very much happy about this program, and of course we would like to continue with that
it changes the economic dynamics and changes them for good, I think, and I really hope they continue also. Sir, आखिर में कोई भी अच्छी चीज़ होती है उसके साथ challenges जुड़े होते हैं, वो उसके बगैर तो नहीं होती, कोई भी चीज़ अपनी hurdles और अपने bumps के बगैर नहीं आती. क्या challenges face किया आप लोगों ने, वो भी क्योंकि ये बड़ा हसास मामला भी है, आप जानते हैं हमारी dynamics को बहुत अच्छे तरीके से.
जी, I think the most important thing to realize is that the inflation cost that, the delays in the construction business and the harsh weather and the terrain difficulty, these are all something surmountable. I think the biggest challenge now is, in order to make them sustainable and connected to the national grid, is to get these clinics impaneled in the public sector database. No need for infrastructure, no need for training HR, community-based people whom people in the community trust, they are coming there. Government has got, this clinic can be an extended arm of government to provide health in the far and wide area. So I think the biggest area is to impanel it. Punjab, it has started. I'm very happy to report that under leadership of Madam and KFW support, we are going into the second phase. Second phase most probably is going to be with KP and in Sindh, where there's a dire need. But I think impanelment and ownership by the government, and to provide commodities related to family planning,
right,
and to use it for their initiative, whether it is dengue or menstrual hygiene or breast cancer or nutrition, stunting, they can address multi-sectoral, and it is sustainable because it is making commercial sense to certain players in the
तो resistance थोड़ी कम हो जाती है.
Absolutely.
अगर commercial एक viability attach हो जाए किसी चीज के साथ.
It has to make a commercial sense because somebody has to do it, and donors can't go on putting in the money forever. So government has to. So this is standing on its feet, and if it is supported by the government and impaneled, I think we are on the verge of creating a transformative change in the healthcare.
I'm so happy to know about all of this, and I feel so overwhelmed also that such good work is being done on ground. आपका बहुत शुक्रिया डॉक्टर सैयद अजीजुर रब साहब, ग्रीन स्टार सोशल मार्केटिंग से आपने नुमाइंदगी की उनकी, और बहुत अच्छे तरीके से जो चैलेंजेस हैं, जो एग्जीक्यूशन का प्रोसेस है, उसको एक्सप्लेन किया. थैंक यू सो मच सर, मिस्टर सेबास्टियन जैकोबी, डायरेक्टर KFW, for your time and for your perspective on such an important issue. Thank you so much, Madam Ambassador. And I would like to take this opportunity to thank you on behalf of our Pakistani people for putting out such great initiatives out there for women empowerment, for healthcare, for our education sector, because this needs a lot of work. So thank you so much, madam.
Thank you so much for your kind words, and thank you for having us.
Thank you so much. It was an absolute pleasure to have you here with us. Viewers, आज के इस special program से बस यही कुछ, मुझे इजाजत दीजिए. अल्लाह.